Today we're going to be discussing the consequences of ischemia. Firstly, starting with the consequences of short-acting ischemia. So firstly, rapid recovery can ensue, which is where there's a correction of pH, recirculation of myocytes, and re-energization of ATP after really brief periods of ischemia. However, this can also end in tissue injury and destruction. There's also preconditioning, which is the heart's self-protective mechanism that can act also in brief periods of ischemia, which prevents longer periods of occlusion and also is protective against oxidative stress and apoptosis.
In the heart, shorter bouts of ischemia, around 5 to 20 minutes in duration, will induce myocardial stunning. This contractile function is initially impaired on reperfusion, but will slowly improve without progress to infarction and in the absence of significant inflammation or necrosis. At this stage, the functional, biochemical, and structural abnormalities that follow ischemia are reversible. In general, the magnitude of stunning is proportional to the severity of the preceding ischemia.
Hypernation is a process that occurs due to prolonged ischemia or repetitive episodes of stunning. This occurs when atherosclerotic coronary arteries can continue to supply blood to the myocardium, making it viable. However, the supply of blood is insufficient to allow for normal contractility. This results in an adaptive response where the myocardium will reduce its oxygen demand to address that reduced oxygen supply. This condition, which is decreased contraction, can be reversed by addressing the narrowed arteries through a PCI and or surgery.
All right, thank you, Sai. Next up, let's talk about the long-acting consequences of ischemia. So during ischemia, the coronary vessels have become occluded. Other than the small amount of flow from collateral circulation, the cardiac muscle receives little to no flow. This area cannot maintain cardiac function and is said to become infarcted. Myocardial infarction is also commonly known as a heart attack. Local vessels in the heart will try to dilate, causing the area to become overfilled with stagnant blood. The muscle tissue will also use the last stores of oxygen in the blood, causing the hemoglobin to become deoxygenated. As a result, the infarcted area takes on a blue-brown color and becomes edematous or filled with fluid. So you can see that on the right of the picture. Within a few hours of lack of blood supply, the cardiac cells will actually start to die. Symptoms typically include tiredness or pain in the chest, neck, back, or arms, as well as fatigue, lightheadedness, abnormal heartbeat, and anxiety. So let's have a look at the areas of ischemia in the heart. On the left, you can see an area of infarction where there's only a small area of muscle ischemia. On the right, you can see where there is a large area of ischemia. So when the area of ischemia is small, little to no cell death occurs. However, part of the muscle may become non-functional as a result of inadequate nutritional supply for contraction. When the area of ischemia is large, like on the right, some of the muscle fibers in the center will die rapidly, usually within 1 to 3 hours. Around the center of dead muscle fibers is a non-functional zone where there is failure of contraction and impulse conduction. Further out from this zone is a zone of mild ischemia where the muscle fibers can still contract, but very weakly. So Mert is now going to talk about the consequences of myocardial infarction.
Thanks, Adrian. So due to the hypoxia of the cardiomyocytes, we have myocyte death. So there are two main mechanisms that are at play. First, it's the ionic channels which get affected first, which leads to dysfunction, and then the different changes in ions such as calcium and sodium, which lead to different resting membrane potential, and also the activation of protease proteins. Also, we have changes in metabolism of the cell. So we go from aerobic to anaerobic metabolism, and this further leads to protein denaturing and leads to cell death. So the three characteristics usually of myocardial infarctions are cell death, arrhythmias, and eventually fibrosis. So that is when collagen and different other connective tissue replaces myocytes. And it's important to know that each of these things are irreversible.
Thanks, Mert. So on to arrhythmias and long-term conditions. The risk of arrhythmic death in survivors of acute myocardial infarction is highest in the first 6 months after myocardial infarction and remains high for the subsequent 2 years. Disturbances of heart rhythm commonly associated with myocardial infarction include atrial fibrillation, heart block, ventricular tachycardia, and fibrillation. Long-term effects include psychological problems such as anxiety, depression, and overdependence, Dressler syndrome, ventricular septal wall rupture, left ventricular aneurysm, and cardiogenic shock.
Yeah, okay, cheers, Simon. Okay, so worst comes to worst, you get heart failure, and that's when your heart can't pump enough blood to meet the body's needs. There's many reasons you can get heart failure, but the focus will be on ischemia. So when this happens, there's death of the myocytes due to lack of oxygen, and there's also fibrosis in the myocardium. This causes impaired ventricular function and therefore reduced cardiac output. And what the heart does in response is that it stimulates the renin-angiotensin-aldosterone system. This increases sodium and water retention from the kidneys. This therefore increases the intravascular volume, increasing the amount of blood going back to the heart, and by the Frank-Starling reflex, it causes the heart to work harder due to an increase in blood pressure. And this increase in cardiac workload on the myocytes causes more myocyte loss and more fibrosis. On the other hand, stimulation of the RAS system also causes vasoconstriction. This increases the afterload and also the blood pressure. And this, again, double whammy effect causes increased cardiac workload on the myocytes and therefore further myocyte loss and fibrosis. And here I've got a diagram which pretty much summarizes the process. And yes, if it's left untreated, RIP,